Well, we do have, in the United States, we really have, I think, strong dietary guidelines on recommendations on what people should eat to have a healthy diet and also prevent the diet-related chronic diseases and also obesity, which are major public health issues in the U.S., but across the globe. So it's just that in most places, people know what they should be eating. People know that fruits and vegetables are good for them, but there's so many forces that work against that. People are hardwired to really like sweets and salt and fat. And in our society, in the U.S., those are really, the food is plentiful, it's big portions, and it's relatively inexpensive. And all of these changes, I think, have really driven up people's weight. I think that we have good guidelines, but to really make the changes, because people are going to have, this generation of children may have shorter lives than their parents do because of diet-related chronic diseases. So I see this as a public health crisis and also healthcare burden. It's going to cripple the healthcare system with diabetes, as well as heart disease and other adverse effects of the American diet. So we have to make changes, but the changes, there's not just one solution. I think that we have to look right now. A lot of children don't even know where French fries come from. They like French fries, but they don't know that it's from a potato. People are so, they don't know where food is grown or, that an apple is from a tree. So I think we have to really start at all levels working together. And I think there has to be public-private relationships and partnerships. The government can't do it all. And it really is going to take, I think, every sector. The food industry is such an important player in all of this. And I think we have seen, reformulations taking place because of consumer demand. I think that's really positive. Schools, we are such an important place because that's where kids are. But I think that it's going to take a lot of work, but the costs are so high if we don't really make these changes. We have to. We have to have the resources, because when you think of the healthcare costs involved and the loss of quality of life, diabetes, heart disease, those are nasty diseases. And I think that, we're not going to have the quality of life, we're not going to have productive lives unless we really invest. We have to also invest in protection, in prevention, not just when somebody has diabetes or has hypertension. We can invest. The best place to invest is young children, in making sure that they're growing up, eating fruits and vegetables and really enjoying a healthy diet.